The way digestion works is first you smell the food. You smell the food, your mouth and your saliva starts to be released into your mouth. And then when you're in a relaxed state, you want to be eating and you want to be chewing. Your saliva starts to digest your starches in your mouth. So that's the carbohydrates. Then you swallow, the food goes down your esophagus and into your stomach. Once food hits your stomach, there was already processes going on previously when you started chewing that your body starts to make strong amounts of hydrochloric acid or gastric acid. This is our digestive fire, and this is very important in the signaling of the rest of our digestion, the sterilization of food, and it gives us the movement that we need down our bowel. And then the sphincter opens that goes into the small intestine. When this acid hits that small intestine, it is like a switch that's turned on that causes the release of pancreatic enzymes and bicarbonate, which then neutralizes that strong acid, as well as bile acids from the liver. The bile breaks down your fat into fatty acids and glycerols. The pancreatic enzymes break down your protein into amino acids, as well as breaking down your carbohydrates further into individual sugars. Only at this point is your body supposed to allow these nutrient foods into your bloodstream. And then that's how we get great nutrition and we allow our body to not be stagnant. What happens when we have low stomach acid is we don't get a good release of those bile salts or bile acids, and we don't get a good release of bicarbonate, and we don't get a good release of our enzymes. And that's when food sits there like a brick in your stomach and it actually putrefies. It's rotting in your insides. It leads to small intestinal bacterial overgrowth because your small intestine is supposed to be mostly sterile and only have specific bacteria that live there that ferment only specific things. The rest of the bacteria are meant to be living in your large intestine. Now, after it's been digested and the nutrients are absorbed, the rest of the material is pushed down by your migrating motor complex, which is controlled by your vagus nerve, which propulses the food downwards, and eventually we will get a bowel movement. But before that, water is absorbed in your large intestine. That's when the fermentation of different fibers from your food are digested, and your good bacteria make very healthy short-chain fatty acids, which are anti-inflammatories and fuel for your large intestine. And this keeps your gut healthy, and this avoids you from having irritable bowel syndromes or any inflammatory bowel disease. The issues that I'm seeing most often are these small intestinal bacterial overgrowths from this lack of stomach acid and one of the most over-prescribed drugs, which are proton pump inhibitors. One of the biggest steps at the Vegas clinic for getting you back to your health is getting that digestive fire, and that number one signal, which is that stomach acid, is getting it optimal levels and getting you off of anything that's impeding that, including getting rid of infections that can lower your stomach acid and getting you off of those proton pump inhibitors and getting your stomach acid to where we need it to be.